Hi, this is Radio Poland, the external service of Polish radio. My name is Agnieszka Łaszczuk, and with me in the studio is Olga Korycińska, a medical student from Warsaw, and a representative of the SASA Foundation. Yes, you're correct, SASA. And first, I would like to ask you, Olga, what language is it? What does it mean?
Hi, Agnieszka. Thank you for invitation. SASA is in Swahili. It means now. It means that students and young doctors don't want to wait. They want to act now. They don't want to wait until they have a lot of experience, but we want to change the world now.
So before they receive a medical diploma simply.
Yes.
Also, yes. So how the idea was born? Tell us, and second, what do you do as a foundation?
Okay. The beginnings of the foundation, of the charity, were when our founder, Gabriela, she went to Tanzania to volunteer for a month. And when she went to the hospital, to St. Joseph Hospital, which we still support and try to support continuously, she saw that they suffer from lack of some basic medical equipment. In that case, sometimes these were surgical gloves for these surgeries, but also things like needles for biopsies, or they just had to count everything, and the situation was so different than what we have in Poland, for example. Even though many people in Poland also feel that our health situation is not so good, then in contrast in Tanzania it was really really worse. So when she came back to Poland after her holidays, she decided to do something about it. She wanted to send a box with all the needed equipment, with some surgical sutures, which are also and were also very needed, but the cost of sending one box individually by one person was so high and so big that she wanted to do something more.
And she decided to establish a foundation.
Yes, more or less it was like that. So more people were involved. We were able to start collecting funds, to do fundraisers, to tell more people about the idea, and it kind of really clicked.
So you're a group of students from the Medical University of Warsaw. Some other people are also engaged in this project?
Yes, of course. This was just like it started from a group of friends from Warsaw Medical University. But we are open to any students, any young doctors actually as well. So actually we are not confined to the Warsaw Medical University. We also had people who are from Poznań Medical University, from Gdańsk, from Krakow. So actually it doesn't matter where you are from. You don't have to be from Warsaw to cooperate, to help, to organize fundraisers, and to just act for a cause.
So how do you collect your funds, and how do you decide where your help is most needed? Because, for example, in Africa, definitely there are many countries and many places that needs help. And as you said, those are like very basic stuff. For example, very basic medical equipment, like you explained it.
Yes, you are right. Probably if we would like to help everybody that needs help, it wouldn't be possible. We are a small charity, small foundation. We are not so many people working every day towards the cause. So for now we are focusing on one hospital because we want the help to be wise. So we are able to be in contact with them. Our also like a backbone of the foundation is also education. We want to educate people here about the tropical diseases, and we want our volunteers to be educated abroad, also in such countries like Tanzania. One thing is that they are able to, in practice, to witness the diseases that are not often came across in Poland. However, many more people travel, so it is very possible that more and more people will come here with tropical diseases, and we should be ready for that as well. And the other thing in countries like Tanzania, sometimes the way of things is more, we would call that old school, but also it makes you think more. Sometimes you don't have so many new diagnostic tools, so you have to think more, or you have to you just see how it's done differently. So it also broadens your perspective as a young doctor or as a medical student.
Definitely. Well, on the one hand, it provides young medical students with some very specific training. On the other hand, you help kids and other people to receive medical treatment. And I wanted to ask, have you yourself been there? Have you yourself worked as a medical volunteer?
Yeah, I was there for almost 2 months in January and February this year.
So what was the most shocking, or maybe the most inspiring, or maybe the most astonishing?
I think I was preparing myself to I'm like an avid reader. I was also always very interested in Koryciński books. So I think I was I was prepared not to be shocked. I don't know how to say that. Even though, of course, it's obvious that there are like certain things cannot be done there. For example, they have only one big oncological hospital in Tanzania. So it makes it very hard. A lot of people have cancers, but usually they come too late, and there is not much that you can do, actually. It's always, whatever country, if we are in the USA or in Poland or in Tanzania, cancer is a hard thing.
It has to be a very difficult experience,
yes,
especially for a young doctor.
Yes, I think so. But also, it's also about pediatric care. The problem in the hospital is that there are not so many doctors with specializations. Most of them are general doctors, and we are able to have a really good training. We have conferences, we have scholarships, we have everything. They don't have it. So the cost of education, of further education, once you become a doctor, is much harder for them, and they have to rely on experiences, which is very good, of course, of older doctors. But they are not very close to this. I think mainstream education, mainstream science that is going on. They are quite far from it. Because, yes, right now, for example, as I told you before, our volunteer, Joanna, I think she has landed in Tanzania today. I mean, she has landed in Nairobi. She took a bus trip through the Kenyan-Tanzanian border. So she is, right now she is going there. And she has in her back, she has an ECG machine, which will be the first one in the hospital. So this will be a really big change for the whole hospital. And you asked before why, how do we know what is needed? We talk to the people. Those doctors are like our maybe friends, we are one big doctors everywhere. They have a hard training, they have to educate themselves, they care about their patients, and there is not much difference on the other part of the world. So we ask them, we see, I was able to also to see what is needed for them, maybe what they could use. So I thought about ECG, and thanks to all the people that donated money, we could buy it.
It's a very challenging experience for you, definitely. But on the other hand, it's a very hard and, I would say, maybe down to earth and very good training for young doctors, definitely. And so, how do you collect your money?
Okay.
And if somebody wishes to donate, then what should they do?
Okay, sure. I think we have like 3 ways to donate. We had a cause at pomagam.pl, and it was like a fundraising page.
So it's a general fundraising page, yes? Pomagam.pl and
yes, in general we had our cause SASA box 2, but it's finishing now. Apart from that, we have our bank account number. And we also welcome any donations. We very welcome donations that, for example, are monthly, because it lets us act, and
it allows you to plan certain
yes,
activities.
and to plan everything. And then we have our wonderful volunteers who we have the teens with SASA sign, and our volunteers go to some street parties, to some public places, because we are allowed to do that. And they collect money. They ask people on the street, which is very, very hard work. Believe me, I used to do this as well. So it's really hard work, but it works. So it's combining those donations and hard work of our volunteers. We also went to the schools. Some people prefer to donate the equipment. So if there is anybody who would like to donate the equipment, please contact us. We know what is needed, what would be the best option to buy, for example, because I understand that not everybody wants to give money, and that's also that's also understandable.
Of course. So we're running out of time, as I can see. So maybe the last question: are you planning to go back to Africa then, and maybe planning to broaden the scope of your foundation's activities in the future?
I would like to go back. But I also want our other volunteers to experience that and to have more education in that matter. So it was my dream. I think I fulfilled it, like some part of it. So now I'm focusing on developing the charity, the foundation, the SASA Foundation, for it to become a little bit maybe bigger, a little bit more successful. And yes, we would like to continue, maybe to find new places as well. But it also depends from money, from our volunteers, and from our work, because we want our help to be wise, to be really fit. We don't want to send anything and say, okay, we helped. We want it to be really needed, really to I don't know, to be really appropriate in that matter, and to do it in a friendly relations, have a good atmosphere between us, between the hospital, so that they could also develop, that they could also educate themselves more.
Of course,
this is our goal.
Good luck with your activities, definitely, and a short appeal to our listeners. If you want to support the SASA Foundation, please try to find them on the web. You have the official website.
Yes, we have official website. It's still in the works though, but it's going to be very, very nice. And we are very, very active on Facebook, on Instagram, and I think on Facebook there are like a lot of our activities. It is the best way to really live the foundation life as well, even from your home. So
thank you very much for the interview then. Good luck once again. I'm Agnieszka Łaszczuk, and our guest today was Olga Korycińska, a medical student from Warsaw.
Okay. Thank you.